Welcome, everyone. The session will begin shortly, so while we wait, please just take a moment to provide your name, state, and organization in the chat. If you have any questions or need assistance, please contact Kyle Erickson at kyle.erickson.1@minotstateu.edu. Project ECHO is a program that helps share specialized knowledge with local professionals. It connects subject matter experts with community practitioners through virtual sessions, making it easier to learn and collaborate. Project ECHO gives professionals the tools to provide better care and support, especially in rural and underserved areas. The goal is to share knowledge more widely, reduce gaps in services, and create a system where everyone learns from each other. This ECHO series is sponsored by the North Dakota Early Hearing Detection and Intervention Program. The purpose of the series is to enhance knowledge of the EHDI system, and our goal is to build territory-level data and measurement capacity to improve language acquisition outcomes for children who are deaf or hard of hearing. Before we begin, I want to describe an ECHO session and what sets it apart from other trainings. In essence, ECHO sessions allow us to move information, not people. It allows you, the participant, to actively learn about a topic and ultimately become a resource for your community. In each session, there will be a formal didactic portion on a designated topic, followed by a case presentation. We encourage you to ask questions in the chat or by unmuting during the Q&A portion of the presentations. Your participation is key to the success of our ECHO sessions. We aim to create an interactive community where our presenters, stakeholders, and community members all communicate and support each other during a session. We encourage everyone to turn on your camera throughout the sessions as long as you are comfortable. We encourage you to be engaged by asking questions and providing feedback. Please feel free to reach out to our team if you have a case that you would like to present in an upcoming session. Individual privacy is of utmost importance to us. When sharing information during our case study discussion, please avoid using real names or initials. Please do not identify any individual's family members, friends, coworkers, or email addresses. Your attention to confidentiality helps create a safe and respectful environment for everyone. To receive credit for your attendance today, please fill out the evaluation that will be sent to you after the session. You can earn professional development credits in social work or a certificate of completion for your participation. Your feedback is important, so thank you in advance for taking the time to complete the evaluation. Now I would love to introduce our speakers for today. Nicole is the Parent, Infant, and Outreach Specialist and Coordinator of the Parent-Infant Program and School Age Outreach for the North Dakota School for the Deaf, serving children and families in their homes and communities ages birth to 5 years, as well as students in schools that need support. Nicole is also an adjunct professor for deaf education courses at Minot State University. Jordan is the Early Intervention Specialist for North Dakota Health and Human Services Developmental Disabilities. In addition to her state-level role, Jordan is a part-time instructor in the Department of Teaching and Leadership at the University of North Dakota, where she teaches courses in early childhood special education and autism spectrum disorder. Welcome. Take it away, guys.
All right, let's see if, there we go, I unmuted. Hello, everybody. Thank you so much for letting us be a part of this session today. I know Nicole and I are both very thrilled to be here. So we will be discussing Part C and the parent-infant program today and how we can better collaborate. And then we also have a parent that is amazing and agreed to join us today. So, all right. So the big question is why should we collaborate, right? So 1.8 out of every 1,000 newborns in the US are identified as congenitally deaf, hard of hearing, or at risk for delays or deficits in language acquisition. And then 3 out of every 1,000 are identified with a degree of hearing loss at birth. And then another 3 out of every 1,000 are identified with degree of hearing loss in early childhood. So some pretty significant numbers, but these are the most significant. Newborn hearing screenings are completed on 96% of infants in the United States by 1 month of age. That is a great number, but we want it to be as close to 100% as possible. So out of that 96%, only 43% not passing that initial screening received diagnostic hearing evaluation by 3 months of age. And then this was the most jarring for me as a early intervention professional. Only 42% of infants with confirmed permanent hearing loss were receiving those Part C early intervention services by 6 months of age. So less than 50% received early intervention services by that 6 months. So that is why effective collaboration between the parent-infant program and early intervention is crucial. And then how is it funded? So it is embedded in IDEA. IDEA requires that the state child find system is coordinated with specific agencies, including EHDI. So the Children's Health Act of 2000 gave 2 agencies as the federal entities that provide funding and TA support. Those 2 entities were the CDC and HRSA. The CDC is the Center for Disease Control. They develop, maintain, and improve data collection systems. And then HRSA is the Health Resources and Services Administration. They are charged with developing and monitoring the efficacy of the system. So, and then this funding allowed statewide newborn hearing screening and intervention systems. And it follows the 136 guideline, which Nicole will get into a little later.
Hi, now I'm unmuted. Everyone can hear me. Very nice introduction, Shelby. Thank you. And Jordan, and happy to be here, as Jordan mentioned. And some of you may be very familiar with how we work in the state of North Dakota. I know there's other people that aren't from the state that don't have the same program systematic look to things. So it's fun to be able to share how we're doing. Jordan and I have been doing these presentations across our state this fall and winter to all of our DD program managers and program assistants, and then all of the early intervention and Part C providers. So here in the state of North Dakota, our parent-infant program is through the North Dakota School for the Deaf, and we work specifically with those that are impacted by hearing differences, whereas the EI Part C programming is much larger and providing those services to all kiddos that may qualify for any sort of delay or disability. We are seeing our families in our North Dakota Century Code. We are given the allowance to see our kids birth to 5, whereas the Part C programming will just go up to the age of 3. But as Shelby had mentioned as well, and several of my team members are on here, and along with Rachel's presentation, Denise Marbach is on somewhere too, and she was the EI provider for our PIP program. And I'm not quite sure if the Part C provider is on or not, but they can chime in with some information too on what that collaboration looked like. But just in our sharing our services, I feel like this winter we've gotten a lot of feedback just because of the turnover, or people who come into their positions and don't know that there's different entities out there providing services. Jordan will get to our MOA and MOU later in the, but having brought us all to the table, seems like it's just like, duh, we should be doing that. But it does take a lot of work and some consistent communication. So just making sure everybody is aware that we're providing that parent-infant program birth to 5, and then we do go into school age, which I'll kind of hit on a little bit later, but very similar to Part C programming, where we're parent focused, it's child driven, and we're providing those services in their natural environments for those kiddos. So our primary goal in our program is to assist the families in making sure they understand the importance of having and developing a solid language foundation. We are unbiased in that aspect. We talk about communication opportunities across the continuum. We are continuously having that conversation. It is never just, okay, we're going to do spoken language and then it's done and over. We continue to make sure parents are educated and understand the importance of making sure that we are developing that language. So 53 to 57% of children identified with hearing loss have no other risk factors. So if we were only screening those infants that were NICU babies or preemies or had some sort of diagnosed syndrome, then we would be missing a large number of our children that we see. And one of the more recent facts that I had just heard in another session was that sometime within the course of a child's educational career, they will be 20% of kids will be diagnosed with some degree of hearing loss. So if we're not seeing it right away at birth, we could anticipate that something will either be diagnosed at a later time or something's being missed. In our state, well, nationally, the Joint Committee on Infant Hearing, the JCIH, following their best practice recommendations, we are involved. Our state EHDI system here in North Dakota helps us, supports us as part of this collaboration as well. Jarush is on here, who is our coordinator for that as well. And really looking at that collaboration, starting at that EHDI starting point, and then going into, in our state, we use ODS to report the babies that have been referred or failed their audiological information, and then going into our Human Health Service Center as the point of entry for the state of North Dakota, then trickles down into our parent-infant program referral and our Part C components. So a lot of different players that are all involved there, and really trying to make this, screened by 1 month, diagnosed by 3 months, and enrolled in appropriate intervention by 6 months. That 136 component that we're looking at nationally, that is showing that's where kiddos are showing the best outcomes, is if we follow this model. And I always say here too, when we're talking to the other professionals that might be working with kiddos that have differentiated hearing, is that appropriate intervention can be specific early intervention, but we also want to look at audiological intervention, so that we are getting these kiddos to their audiologist that can do the diagnosis. Sometimes we have families here in the state of North Dakota that are on Medicaid, and they're sent to an audiologist that doesn't accept the Medicaid, or they're sent to an audiologist that doesn't have diagnostic capabilities. And we've really, in these presentations, gotten a lot of feedback that that's been happening and delaying the diagnosis of these kiddos, and really pushes them down the road. And so really looking at that and knowing what other providers can do to help us navigate the system and get them where they need to be. So again, one of the things we've heard from professionals, the first point of entry person that might get to a family will often say, oh, the family's very overwhelmed with this diagnosis and they're not ready for other professionals to come in, when really what JCIH has shown in their research is that if we give the parents the appropriate support to understand the diagnosis of their child, that they really do reduce that parental stress on them, and it gives them the capability to create that emotional bond, and given the right supports, they get on board a little bit quicker than we understand it's fearful, and Jordan talks about that a little bit too as a parent, but when you start to hear these words and these diagnoses, we get that, but we do want to get them to the right place. So again, that early identification, assessment, and management, we want to be conducted by professionals that have the specific qualifications needed to work with deaf and hard of hearing families or children and their families. and be designed to meet their unique needs and include them as an active and collaborative role, along with all the other professionals that are coming to the table for them. Our primary focus, and this is where we differ a little bit from Part C, is we are looking at things that are impacted by the degree of the hearing difference that the kiddos are going through. Parents understanding those communication opportunities, what language development looks like, what the auditory hierarchy looks like, what is pragmatics and the social use of language, and then community connections and resources. We have North Dakota Hands and Voices here. We know nationally we've been in touch with Hands and Voices and all of the other community resources, Family Voices in North Dakota, and just really making sure that they're getting all of the opportunities that may help support them. So what our program looks like as far as providing our services, we go into the home, we do home visits, very similar to EI programs. Nationally, we can go into daycares or out on a field trip with a family if they wanted to go to the library or something like that, but really doing things that are important to them and providing them the education in the natural setting. We do assessments on our kiddos birth to 5 every 6 months. And I saw Allison is on here somewhere too. I have a separate slide that will talk about our collaboration with University of Colorado and our ELO assessments. We do when we can, when schedules work out and we can help plan to go with families to audiology appointments. I use the example we had heard, I think, one year at an Ed.D conference where a dad had left the audiology office and said, I don't know, she said something about fruit because she had mentioned the speech banana when trying to describe the audiogram, and that was the only thing that dad took away with him from that session. So when we're there and we can help hear that information directly from the audiologist as well, and then follow up with that once we get into the home. And lots of parents I've said, can you get on and talk with my mom about this, grandma or grandpa or aunts and uncles, and they don't understand. They think he'll grow out of having to wear the hearing aids. And so we can really help describe that impact of the hearing loss, what it is, and the new terminology that the parents are getting as far as frequency and sensory neural and all of those things to help them really get that information so that as they continue to advocate for their child and they get into those school age years, they are educated about what the impact of their child's hearing loss is. We have our 2-7-2-9 meetings when kiddos are transitioning from their IFSPs into their IEPs. We are often able to provide those assessments that we have been doing to help program plan for them transitioning into the school age years. We have sign class opportunities for families, either community sign class, we do in-home and virtual. The picture of Ashley up there in the top right corner is her working with a family one-on-one anywhere in the state that they might get that specific vocabulary that they want for, I want to be able to talk to them when we're giving bath time. So it's not just like ASL 1 vocabulary, but that they are getting the specific signs that they could use in their home on a frequent basis. We have our parent listserv and a Facebook page. When we have the capacity and the numbers to do so, we've done a language and auditory fun therapy group, which was kiddos 18 months to 3 years old, which is super fun to bring them together because more often than not, we have kiddos that don't see any other child that has equipment like them. So even that piece coming in and working with them is nice to bring together. We've done play groups for our families, and then newly we have a deaf mentor program and are working on expanding that as well.
So what is the difference between early intervention and the parent-infant program? So early intervention, we monitor global development. We look at all areas of development. We focus on that routine-based parent coaching through our home visiting services. And funding is through Part C of IDA and through the state of North Dakota Medicaid as well. And then the focus of the parent-infant program, is on development related to hearing differences. So communication opportunities, language development, pragmatics, auditory hierarchy, community connections, and resources. Funding is through the state of North Dakota, and it is not through Part C.
So on our team, as many of you may know, there are 7 of us in the PIP outreach team, and we are all teachers of the deaf by training. So we all have deaf education degrees, along with being Sky High trained out of Utah, which is a curriculum that is very specific to kiddos that have hearing differences and diagnoses. And so that ability to look through the telescope lens of a child that's impacted by differentiated hearing levels and doing those assessments and following the curriculum that's advised. So as I mentioned before, we are part of a collaboration with ELO, the Early Learning Outcomes, which previously was Odyssey, if anyone heard of that, and before that was NECAP. So we've had a long history of doing this with the University of Colorado, and Allison Setti, who is on and has come up to North Dakota and done trainings with us. So it's a very nice collaboration. This year, as the funding source has changed, our North Dakota EHDI system is actually helping us fund that collaboration with the University of Colorado. So we are very fortunate and excited that we get to continue this and doing these assessments for all of our kiddos. As I think, is it the next slide? As Allison and her team gather that information to look at really what is the impact and what is the best practice, where are we seeing the things that matter fall into place that look at the outcomes being met for kiddos at their 3rd birthday, when we want to look, and nationally the EHDI system wants to look and gather that information and analyze that to share with programs. As part of the ELO, these are the assessments that we are doing, all of our birth to 3-year-olds. We are doing a DAISY-2, and the really great thing about this that we've done in our state with Jordan and I talking to the Part C programs is they are also sometimes using the DAISY-2 or a subtest here or there for their assessments. So if they know we're going in every 6 months, it's a set standard time, and they need an assessment piece, we can either do that together with our Part C provider or share that information so that we're not duplicating or confusing parents on what that looks like. That being said, when Jordan said, Part C focuses on that global delay, they're looking at all areas of development. We do as well on the DAISY because we're administering the DAISY and we're looking at that. If we saw concerns in the area of motor, let's say, we would certainly be making a referral and talking to OT, PT, what that might look like as far as a Part C provider. Did I hear someone? Okay. We also do the MacArthur Communication Developmental Inventory for our kiddos. We're keeping a track of their language development, vocabulary development, making sure that's coming along the way we want to set that expectation for them to develop their early language skills. And then the little ears is an auditory checklist that we do up to 24 months. And we're often using that to share information back and forth with our audiologists as well, so that they know what is going on in their natural environments and how that's affecting their listening skills. The Cincinnati auditory checklist we move into as they get older, and then using our Sky High language development scale can be used as well. And then we can continue and do for some of our kids 3 to 5 using all of those same evaluations and adding in a pragmatic skills checklist. And for those that may have more global delays, we'll look at using a DAISY along with the communication matrix. There's my lovely team. And so I just wanted to show you all, we all are graduates from Minot State University in the Deaf Education Program. So that's when we present people in our state, I'm pointing them out so you know regionally who you might see. But because there's more people on here, I don't think I need to do that right now. But they're amazing. So again, just sharing with families, and I would encourage if there's anybody on here trying to get more information and they're not in the state of North Dakota, that you kind of investigate where these people are that provide this service that would be deaf specific or looking at those differentiated hearing levels. We have started talking with people in our state now to call us, even if they have a suspected hearing loss, not that they're putting a referral into us or that we would start we would enroll the family in our program, but we can still help navigate them to get what the answers they need. And this has been happening more and more now since we've been doing these presentations. I had a Part C provider that was at a family's home, and they had gone one place and pediatrician sent them a different place. And so she was like, what is this? What is an ABR? And I just got on the phone and I talked with parents during that session, and it really helped get them where they needed to be and help them understand. Not understanding that an ABR is something where they're generally sleeping, or they might be sedated, or they might have it done when they're getting tubes. Just all of that specific information is helpful for parents to get an idea of what's going on. And again, families in North Dakota and those who are birth to 5.
So the big question is, how do we bridge early intervention and the parent-infant program? So or what are some ways? So you know, just to kind of think about some of the similarities, EHDI must refer children to early intervention and the parent-infant program as soon as possible, but no later than 7 days after that child has been identified as having that hearing loss or developmental delays. And one thing we really point out to our providers is the effectiveness of early identification of children who are deaf or hard of hearing depends on what happens after that initial identification has been made. So we always say, AKA, it's in your hands. So that family, when we are the service providers, if we know of a service that can help that family, it's in our hands to help that family reach that service. So, and we always say this to our providers or talk about this point because it's just, it actually really, it really brought it together for me. It shows that we have the shared recognition that a child is a unique individual whose strengths and needs must be clearly and accurately identified, and whose family is empowered to express their questions, concerns, knowledge, hopes, and dreams that ultimately inform decisions made by the family. So Nicole and I always like to point that out because it's just, I think it's beautiful. So that we have that shared understanding. So, and then Nicole and I are actually on the EHDI Memorandum of Agreement Advisory Committee. Basically what we did was wrote up a memorandum of agreement. We worked with our newborn hearing screening director and public health and vital records, and we created a memorandum of agreement. I believe it is in its final stages of signatures right now. And then what we are going to do is send that out to all of our service providers, service coordinators, anyone that's associated with this memorandum of agreement. So, and how to refer. So we always tell our providers, we always give our providers a referral packet. And in that referral packet, Nicole and I should say in our presentations, give the referral packet. And in that referral packet is the referral form, a signed release of information, so a correct release of information, so they're not just using something random. And then we ask them to send the most current evaluation, most current individualized family service plan, OAE and tympanogram results if they have them, and then any other pertinent information such as consults or reports, evaluations, things like that. So, and the parent-infant program has 7 business days from the day that referral is received to respond to the parents. And one thing we do at the end of our presentation is we talk about frequently asked questions. So we kind of go through these, and then at the end of all of our presentations, we're going to send out this PowerPoint with all of the frequently asked questions, and then they'll be able to utilize those in the future. So, you know, some of the big ones are, what if I get a child on my caseload with a hearing loss diagnosed after being in services for a year? And that's, we're referring to being in early intervention for a year. We just say, obtain that release, talk to your service coordinator, and you know, get that child into the parent-infant program as soon as possible. We talk about that there's so many unique situations in the birth to 3 world, right? Sometimes you get a child referred and it can take 6 months to a year to get the child in to see an audiologist or in for diagnostic services. Sometimes even just to have that parent feel ready and comfortable to have their child be referred to those services. it's not an easy thing, you know, and a lot of times parents are grieving, or you're just trying to navigate parenting a 1 and 2 year old, right? So yeah, so that's one of the popular questions. Who do I contact for a referral? In that referral packet, we put all of the amazing that 7, 8, including Nicole, parent-infant providers and their contact information and locations on a Word document for them. We encourage them, when in doubt, we've been using this phrase, when in doubt, reach out. Just reach out to any of them. And I also ask that if they're really unsure, just please send that referral to me in the Part C office, as I'd be happy to get that to Nicole, you know, as soon as possible. So, and then this was another big question we get a lot is, I have a child with a hearing loss on my caseload. The parents are unsure about the idea of having another agency in the home. So what do I do? We have had some really great conversations with different groups about this. You know, we ask them, they ask the family, can we call the parent-infant provider? Can we meet somewhere outside of the home, the library, McDonald's, the grocery store, while we're working on one of your IFSP goals, and just have them tag along? A lot of times I think it's natural to feel hesitant, to want to, you know, add new people into your home when you're already going through a lot as it is, right? But just having them reach out to that parent-infant provider and be able to just make that initial contact is huge. Nicole also had a great idea as well about potential for FaceTiming, or you know, use of that virtual technology to help families feel more comfortable as well. So that's another big question we've gotten. You know, can parent-infant and early intervention go out at the same time? And we are absolutely encouraging that. We want that. So for those of you North Dakota early intervention providers that are on today, please, 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 once again, have the parent-infant provider go out with you. And it doesn't have to be every time, but you know, connect, talk about what you're doing, you know, try to see what you can do to implement what parent-infant program is working on, and early intervention. It should hopefully connect. So and so yeah, so there's just some of the frequently asked questions. And then we provided some resources for providers. So the first one is the North Dakota EHDI Hearing Roadmap. And it just kind of gives a beautiful roadmap for families in what that the whole process looks like. And then the next link there is, you can see it's the flipsnack.com link. I see Linda's on today, but she created this beautiful resource manual for providers and families. And it talks about what's an AVR, what's a tympanogram, OAE, just things that I feel like as a parent myself, if I wasn't in this field, I would want to know what those were. And you hear these big terms sometimes, and you leave the medical provider's office or therapy provider's office or even early intervention sometimes, and you're like, wait a minute, I should have asked what that was. But Linda made this beautiful resource manual, and it is phenomenal. So we give that to our providers as well. And then there's 2 really nice YouTube videos that just kind of show what the parent-infant program does. And I think they are wonderful to use with families. I know myself, I'm a little type A, and I like to know what's coming next or what's about to occur. So I love watching you know, videos or reading manuals about what to expect. So just some resources for our providers. So, and then, so yeah, that's the end of our presentation that we share. And then we give our contact information. My supervisor, who is the Part C coordinator, Jackie Udusameli for the state of North Dakota, is on here as well. And I encourage them to reach out to myself or her, and then as well as Nicole. So, so yeah, that's the presentation that we share. Nicole, anything you want to add?
I was just going to say, in addition to, if you weren't going to look here where Jordan had put those links, we also on our North Dakota School for the Deaf website do have that resource manual if you wanted to look and see what kind of information is in there. It's rather lengthy, so we don't ever just print the whole thing out and take it to families, but we do share pieces as it as it pops up. And our referral form is also on our School for the Deaf website, as well as our brochure. And then I did see Kathleen had asked a question about our outreach team services. If I answered this correctly for you, let me know if I don't. We do provide the schools. So as kids transition, that 3 to 5 range too, they may or not, sometimes they transition and they are eligible for an IEP and they get services. They may go into a special ed unit that has their own teacher of the deaf, and sometimes we're helping and consulting and supporting those kiddos in that capacity. But some of our kids are in rural areas that do not have teachers of the deaf, and we will continue to provide services to those schools and those teams. We do assessment, we do consultations, we do in-services. So there's quite a variety of information and education and support that we do for kiddos. And we also help support those kiddos. So if they don't qualify for IEPs, they might be on a 504, talking to a 504 coordinator, getting them in touch with the audiologist, what kind of equipment is needed? Do we need to troubleshoot? Do we need to get out there and help support them with those types of challenges and concerns too? So we really do, we want to be that resource. We want to be that support. We do not expect a district or a regional program to have to be serving those kiddos all by themselves. We want them to know we're here. I hope that answered that.
Yeah, I just, in some states, including my own, there's big battles about if the outreach team from the School for the Deaf is involved, then it's a recruiting mechanism for all kids to use sign language, which is not true and has never been true. But I just wondered, we have districts who the teacher of the deaf was trained in K through 12. And then there's some discussion about whether that person should be doing early intervention. And it's just, I just wondered, like, if you could kind of talk to the rationale of using people out of your outreach program as the provider.
Yes, you're exactly right. We've had that kind of stigma here in North Dakota in the past too. I think we're growing and leaning a little bit further away from that mind of thinking. But the SPED directors, I will say that too, they will often, or have in the past, not thought to call us and involve us with those kids because those kids they're in the mainstream. They're not going to go to the School for the Deaf. So why would I call the School for the Deaf? I think some EI providers think that too, like, we are providing the service and the parent doesn't want sign language. So why would we call the PIP provider from the School for the Deaf? And so we have talked with our providers here about it's so much more than that, and just really focusing not on the communication modality, but that there are very deaf specific kinds of interventions and strategies. Talking about really our training, when you think back to our training and deaf education and how that looks, to be able to help providers do that. And SLP, when we have good relationships, they really get the difference, right? And so they call us in to be collaborators with them instead of thinking that we're recruiting or just trying to, get services or bring the child to the school. That there's so many more. We'd had Capital Days the other week up here, and we had a few of our providers were there, and they, legislatively, they always want to know how many kids are on campus at the school, but really the amount of kids that we are providing services to through the School for the Deaf is a much larger number. And this collaboration in the early intervention world is super helpful for that, but also to really get out there and have these conversations, sitting down with the coordinators and the SPED directors and those boots on the ground SLPs and other TODs, or even just special educators that might be working. Denise and Linda are both on here and gave presentations yesterday to OT and PT students that are going to be working in that field, and really getting our services out there that we are here to help you. It's not a communication modality that we're specific to, or an on-site residential kind of community that we are saying is needed as well. Thank you. There's not any other questions.
Yes, thank you so much for all of that great information. And now I would like to introduce our case presenter, Rachel.
Hi all, I just want to make sure that everyone can see my screen.
Yes.
Okay, excellent. Hi, I am Rachel. I am the parent that is here. I have a daughter who is deaf and has been served by the Parent-Infant Program for School for the Deaf. Um, so I wasn't entirely sure what all to talk about, but I'll kind of start with introducing our story. On January 2nd of 2020, my daughter Grace was born. She was actually born out of town. She decided to show up a month early. I gave birth to her at a tiny little hospital in Minnesota. And other than being a little bit early, everything seemed to be normal. We stayed a couple days extra due to some jaundice and wanting to make sure she fed well. She was screened while she was inpatient as a newborn for hearing loss. And she did refer. I don't believe it was both ears. I believe it was just one. However, we were told that the testing equipment at that hospital had been referring for everybody that week. And because of how small their hospital was, there was only one machine. And we would just need to follow up. We did not have any concerns with her hearing at the time. When we came home, if our dog would bark, she would wake up, she would startle, things like that. So we did not have concerns for that. When Grace was 11 days old, things went downhill. She was not feeding, she was making strange sounds. We took her into Ultra Pediatric Clinic, who quickly sent us to the Ultra emergency room with our 11-day-old baby. She was life flighted to Sanford PICU in Fargo, North Dakota. For those who are listening from another state, we only really have one children's hospital in North Dakota, so it's yeah, if you have a significant health concern, that's where you're going. She was diagnosed with meningitis. It was a late onset environmental GBS exposure is what they are thinking. I know everybody's wondering, I was negative. I actually received the antibiotics during labor anyway, because she was early, but they do feel it was some sort of environmental exposure. And unfortunately, due to that swelling of her brain, she did experience a cerebral infarction or a pretty significant stroke. So Grace was in Sanford Hospital for about a month. On February 11th, we were released from what we kind of call our big hospital stay. Our initial hospital stay, looking back, needing to be in her birthing hospital for only, 3 days, not at all a big deal when you then go on and have a very, very sick child in the PICU and having, a month-long hospital visit. So this picture is of Grace on her second coming home. So this would have been 5 years ago when she was released from Sanford Hospital. There was concern of hearing loss while she was in the hospital at Sanford. One of the antibiotics she was placed on for the meningitis and to save her life was a medication called gentamicin, which is known to be ototoxic. I know I'm using lots of words here. I'm sure everybody in the hearing world is familiar with these. I'm a research nerd, so these were all things that I needed to find out. But so there was that risk for hearing loss. We did notice a couple days into her stay in the PICU, there was a certain paper towel holder that would automatically go off when someone came in the room due to where it was located. And when we first arrived, she would startle to it as soon as she was off sedation. And within a few days, when it came in, she was no longer really startling to that big noise. And we couldn't tell if it was hearing loss or if it was, just sort of, becoming more accustomed to the noises in the hospital. But we were told that we could not get that hearing screen in the hospital, but it should be prioritized as soon as we were home. So 3 days after we had been home from Sanford Children's, we went to the local audiologist here in town, which would be in Grand Forks, and we again received those. We received referred for both ears. This was super frustrating to me as a parent. I had no idea what referred meant. Um, I have a background in social work, so I thought referred to what? What are you referring me to? What is going on here? And I actually had quite a meltdown at the audiologist because I could not believe that she would tell me that my child may not be able to hear, but she couldn't tell me that for sure until next month. It was just absolutely wild to me that I had to go home and think about this for a month. So I was very upset with her, as I'm sure many parents are. Nobody really thinks about that, especially having come from a hospital environment where we were receiving tests, we were getting answers. How could I not know for an entire month if my child that has had all these huge health issues can hear me or not? Um, well, we went back, obviously. March 17th, we returned to the audiologist. Um, and at this point, we were diagnosed as having severe and severe profound hearing loss in both ears. Grace was recommended to receive hearing aids. Um, I will say that it took us a few visits in order to actually determine what her official hearing loss degree was, simply because when we would get to something that Grace could possibly hear, she would startle awake and we would have to start the entire process over again. So this poor audiologist that I had been very, very angry at, then got to have me in her office for many hours at a time. Um, yeah, but so we were diagnosed. We were referred in for hearing aids. We were really lucky in that there was a pair of loaners that had been provided to the audiology clinic. We were warned that these hearing aids might not do much, but because she had had that meningitis and she was at risk for ossification of her cochleas, it was best that we kind of started figuring out what was going on and what our plans were from there. Um, this was also the day when she asked if she could refer us to the parent-infant program or the school for the deaf. Um, my husband was initially not for that. I was for that, but my husband was not, simply because of the fact that he thought that meant that we would need to send our baby somewhere. And that had been a concern when she was at the Sanford PICU, when we started beginning our line lists of all the diagnoses that had come across after her after the brain injury from her stroke. Um, but it was explained, no, somebody will call you. They'll talk to you a little bit more about the program. We said okay. So I would say probably within a week we got a call from Denise from School for the Deaf. She had to listen to me unpack a lot. um, and at this point we were in the middle we were starting with COVID. So that was unfortunate because um we'd been receiving early intervention. Sorry to hop around here. We'd been receiving early intervention since our discharge from Sanford. Um and they'd already had to start, cutting back, like, can we have people in the house? Which kids can we visit? Things like that. But so Denise called, I talked to her a bunch. She actually sent us out a little packet right away. And we didn't necessarily understand all the things that were in the packet. There were some learning toys, there was a headband because she knew she was getting hearing aids, things like that. Um, and like things like the Ling sound toys, I wouldn't know anything about those until, a little later in our journey. But for some reason, that packet made us really excited to meet her. She understood about babies like my daughter. The things that I was talking to her about weren't weird. So we were really excited to meet Denise. By the pretty soon into meeting Denise, we'd already had, we had multiple diagnoses. We knew something was going on with her vision. She's currently diagnosed as deafblind, I guess plus, depending on your community. So my daughter also has cortical vision impairment. We ended up with a few months after she was discharged, we did end up with a hydrocephalus diagnosis, and then a VP shunt. Um, and I would say probably global development delays is what she's classified as. She currently uses a wheelchair, is learning how to use a walker. So, all right. So fast forward into that. Denise spent a lot of time with us. She pretty much did anything possible to get in with us as she was able. That meant when masks came into play, she was wearing that mask, she was washing those hands, she was temping herself at my house, hand sanitizer, all those things. Once we'd met her, she was one of the few people that we were allowing into our little, I guess, COVID bubble. We were letting early intervention in and we were letting Denise in. Otherwise, we were, our house is kind of closed off. But yeah, we learned a lot. I had started learning some sign language, for Grace, and then when we learned about the vision issues, that was sort of just an additional punch. I will say going into everything, I was not scared for my daughter to be deaf. I grew up in the same town that the Iowa School for the Deaf is. So I grew up seeing deaf kids at sporting events. I grew up seeing, deaf people in the grocery store. I grew up seeing deaf people working. So being deaf wasn't necessarily my concern, but it was having a deaf child that had all these other issues. Um, in my mind, I thought, okay, so she's deaf. I'll learn sign language. This will be okay. Well, then they say your child can't really see very well. Oh, crud. What do I do now? So, um, I will say that something I really appreciated was that there was not a communication modality pushed on me. Nobody said you should have this, you should have that. We did make the choice to implant Grace. And the reason for that is that even once she had experienced that brain injury and had that hearing loss, when we would put on music, that would be the most active for her. We would see her kicking, we would see her smiling. Even that vibration that she felt, um, just seemed so satisfying. She just loved to have it around. She'd love it when I'd hold her and sing. And so we decided with all the unknowns, at the very least, we'd like to try to be able to have her enjoy music. So we did choose to move towards implantation. Because of the meningitis, she was sort of, I guess, fast-tracked into implantation. And she was able to be bilaterally implanted when she was 10 months old. We had that done at Sanford Health in Fargo, and she was activated exactly a month later. Again, we were in the height of COVID times. So unfortunately, we were not able to have our parent-infant person there during our audiology visits or during activation. We actually had to get a special okay from the health system to have both myself and my husband there for her activation. So let's see. Oh, sorry, I'm trying to turn the page and it doesn't want to let me. There we go. So some highlights that I wanted to put out there for people that work in or use the parent-infant programs. The biggest thing that made a difference to us right away was having those listening ears. We live in North Dakota. There's not a lot of deaf people. Um, I always feel that I've had more experience with deaf people just growing up than your average North Dakotan does because we're such a small census state. So I loved that Denise had ears to listen. My questions weren't dumb, my concerns weren't dumb. Um, you know, she, I just felt like she'd been there, done that. Even though she didn't have a kid that was deaf, she'd worked with so many that my questions they were not strange, they were not weird. She'd been there, she'd done that, she'd seen that, she was willing to problem solve with me, and that meant a lot. Um, the program was able to connect us to the deaf community and some of our friends. Again, not a very big deaf community in North Dakota. And nowadays, I kind of joke when we go to an IEP meeting and somebody will bring up, well, I've had a student. I say, well, there's not that many of us. We all know each other. um, but we got in contact with Hands and Voices. We were able to make some friends through that, just see other kids with hearing loss, see what their parents are doing, what is working for them. Um, we have one friend that has a son who, as far as I understand, his only exceptionality is hearing loss. And sometimes when I'm having cochlear issues, I will call his mom because I need to have him help me problem solve. I say, Grace is pulling off her implants. She's doing that. She's only doing that. Like, do they sound funny when the cochlear, when the coil starts to die? Is this a thing? Or do these noises sound weird? Can people with, do they sound different in cochlears, do you think? He can't answer all those questions. His access to sound is different than hers. Um, but it still meant a lot to have that connection to another kid. Um, Again, the experience with her working with deaf kids, again, in the North Dakota environment. We don't have, for example, daycares in North Dakota that work with children specifically with special needs. The deaf program is in Devils Lake. They do have a preschool, but they don't have, like little satellite locations where everybody's going to a deaf preschool. So we were able to get, information about what are other parents doing to make this work. What are things we should be doing to make it easier at daycare? Um, our parent-infant program went a bunch of different places with us just to kind of help folks understand. She in-serviced our daycare providers a few times. She would go and actually do visits with Grace at her daycare, which was really nice. It kind of showed the teachers how she would communicate with Grace. And the other little kids just loved it when she would visit because, it's an extra person. Um, let's see. And the flexibility with visits, we really appreciated. Again, everything was happening during COVID. But what was tricky about COVID was we were not parents that got to stay home during the lockdown. My husband and I both work in healthcare. I was fortunate that I was working from home, um, but he was working in person most of the time. And we couldn't just stop our lives and only concentrate on this. We needed to continue providing for our family. Um, and everybody was very flexible with us. That was extremely important because we had a child who was attending multiple therapies a week. We were having early intervention come in. Later on, we were having school for the blind come in. In the first year of Grace's life, I would say we probably had 2 doctor's visits a week. So Denise was able to work with us to kind of prioritize how we could get her in. Sometimes that meant she was coming at the very end of her workday. Um, so we would pick Grace up a little bit early from daycare so we could still work our 8 hours and we would have Denise time. As she got a little older and more comfortable with Denise and we were more comfortable, some of those visits were taken place at her daycare. Again, we thought it was great because the teachers could see somebody working with her, interacting with her. She's not going to break. It's all good. Um, Let's see. And then as we went on transitioning to preschool, so Grace is actually in the middle of transitioning to kindergarten. She will be in kindergarten next year, which is absolutely ridiculous. I feel like she's been in my life no time and all time, all at the same time. Um, but along with taking our early intervention person to those meetings, we took Denise with us all the way up to that 3-year transition. In Grand Forks, we do have a teacher of the deaf that is on the Grand Forks Public School staff. Um, but we were able to make that connection, which was really nice. Helped us with a lot of things that we might need to ask for. Everything from making sure that they had the mic system ready for Grace, to making sure that her IEP included things like that she could wear her pilot hats if needed so that she could keep her equipment in place. Um, yeah, and then finally, just the no wrong questions. No wrong questions or no wrong door is something that I always see people try to advertise or say our program will tell you there's no wrong answer, no wrong door. But I really felt that way with this program because I would have questions that I couldn't, that I had that, maybe didn't even concern the program. But we didn't know where to go. So we'd ask early intervention, we'd ask Denise. That was kind of what happened. And so it was really nice just to have somebody be able to say, yes, this might be hearing related. No, it's not. This is what we can do. This is what we can't. It was just, it was great. Otherwise, yeah, I don't know. We miss Denise. When she's at events, we love to see her. She's on our Forever Christmas card list. Just for being an excellent, excellent friend to our family and my daughter. So that's kind of all I have. I kind of had an informal presentation, but I'd be happy to answer any questions or talk about other experiences if people are curious.
Thank you so much for sharing. And there's lots of thanks in the in the chat too. And everyone's saying how adorable she is.
Oh, yes, she loves Target. I guess I didn't mention that. She loves Target. I think she wants to work there, so that was her Halloween costume.
Oh, that's awesome. Does anyone have any questions for Rachel?
I just want to thank you, Rachel, so much. And I think when Jordan and I talk about the services that we're offering here in the state of North Dakota, to get the perspective that you had in both entities and those providers, and welcoming them into your home. And it sounds like they both were wonderful collaborators with you. I just really appreciate hearing that from families. It's more important that we get to hear your voice than ours. So thank you. Thank you very much.
We appreciate that. That's why that's why I was willing to do the call today, is because we just really appreciate everything that's been provided. It's meant a lot. And I will say that we haven't kept every provider. We were really lucky with our early intervention team, but we did have one therapist that, we actually had talked to a few of our different interventionists about, and we decided that's not right for our daughter. We got rid of her. We got a second opinion basically on that therapist, and things really started growing with her. So, learning how to advocate and when it's okay to advocate is something that was also really important to learn.
And such a great skill to have, that advocacy piece. Well, thank you again so much, and everyone for participating. Please, there's a link for the survey in the chat, and join us next week. We'll talk more about the North Dakota School for the Deaf, but also the Deaf Mentor Program.
Thank you for having me, everybody.